I do that, let me come to Helen. And Helen, in the work of the Red Cross, Red Crescent societies kind of thing, and we know that you all are very much engaged in addressing vulnerabilities, populations, not in a certain sense without distinction as well. The way you all reach out to populations of migrants, asylum seekers, refugees, whatever that might be, kind of, and the service that you all provide. Uh, do you think that your engagement today in the migration discourse, and particularly in our own region of Asia and the Pacific, uh, your work has helped governments understand more the need for policy change in the current kind of response we have in the region to migrant workers?
Thanks, William. Well, yeah, it's a good question. It's an important question. Yeah, is it making a difference? Yeah, I mean, so much important points have been raised already by the previous speakers. But I'm really grateful for the opportunity to participate, to contribute perspectives from the International Federation of Red Cross and Red Crescent Societies. We're the world's largest humanitarian network, but we're founded on our 17 million community-based volunteers who are working mostly in their own local contexts. We've got a presence around the world in 192 countries. So, with that presence, we're witnessing the enormous suffering that many migrants face during their migration experiences. So we have a presence throughout the migratory routes before departure, when people are in transit, while people are abroad, and also upon return as well. But as you mentioned, we are an exclusively neutral humanitarian organization. So our aim is to respond to humanitarian needs, to reduce suffering, but without seeking to encourage, discourage, or prevent migration. We had very strong engagement with the negotiations towards the Global Compact on Migration. We came together as a movement with the ICRC, the International Committee of the Red Cross, and our 192 national societies at the regional, global levels, but also at the national levels as well, involved in many of the negotiations. All the time, we insisted that the compact could not succeed in fostering safe, orderly, and regular migration without also outlining basic minimum standards of human dignity. And this human dignity must be afforded to all migrants, irrespective of their status. So we were calling upon states to respect their obligations under international, as well as their own domestic laws as well. Our advocacy focused on 4 humanitarian priorities. Firstly, that migrants and refugees must be protected throughout their full migratory experience from violence, abuse, and other forms of violations of their fundamental rights. Secondly, that migrants, irrespective of their legal status, must have effective access to essential services and humanitarian assistance. Third, that the rights and needs of the most vulnerable, especially children, must be prioritized. And finally, that detention should only be used as a measure of last resort, complementing what was just said by Irene from UNICEF and the work of the International Detention Coalition and others. We welcome that these priorities are well captured in the final text of the GCM, and we are now actively urging states to turn their commitments into reality. And we stand ready to support all states in that regard. In particular, we appreciate the recognition of the International Red Cross and Red Crescent movement as a key stakeholder in paragraph 44 of the Global Compact. And we're encouraging states to partner with their National Red Cross or Red Crescent Society. National societies are auxiliaries to the governments in the humanitarian field. So this can very much speak to the Objective 7 to assess and address vulnerabilities through understanding the protection and assistance needs of the most vulnerable. Many national societies are already cooperating with local authorities to help identify and understand the vulnerabilities and risks faced by migrants through the networks at the community level, through the branches of Red Cross and Red Crescent located along borders and in other significant locations. And this is what's providing a strong evidence base for our humanitarian diplomacy with governments, and hopefully to inform policy-making decisions. A robust understanding of vulnerability and risk is particularly important during disasters and crises, all disasters and crises, but especially, for example, in the context of COVID-19, where we are seeing responses very much focused on citizens first, and increasingly negative narratives towards non-citizens, migrants, refugees, and stateless people. So ensuring that all people, including migrants, have effective access to essential services is critical to addressing vulnerabilities. And the COVID-19 pandemic, as Patrick has already expanded on, has illuminated and exacerbated the disproportionate risks that migrants face. Since the start of the crisis, and in the global appeal that was launched by the Red Cross Red Crescent movement, migrants and displaced people are a strong focus of our response at the local, national, and regional levels. In our humanitarian diplomacy, we advocate for the necessity of what we call humanitarian service points. These are safe spaces, protection spaces, that ensure that firewall between authorities and service providers to enable migrants to have safe and effective access to the humanitarian services that they need. So this includes access to healthcare, to psychosocial support, to legal support, food, shelter, and information at all stages of migration. I'll share one positive practice example with you from the Maldives, a country where 1 in every 4 people is a migrant. When the government of the Maldives planned to undertake COVID-19 screening of migrant workers, and many of the migrant workers in the Maldives are not in a regular status and might not have current identification documents. The Maldivian Red Crescent immediately engaged in high-level closed-door dialogue, humanitarian diplomacy, as we call it, with their government. And the outcome of this was that they secured an agreement with the government, ensuring that any information collected from migrants would only be shared with the Ministry of Health for the purpose of contact tracing, and that migrants' legal status would not be recorded. In partnership with the local authorities, the Maldivian Red Crescent then established a migrant support center where their volunteers, and they include migrants in their volunteer base, coordinated food distribution, and they operate a COVID-19 call center, a hotline to listen to migrants' own needs and concerns. And in a way, it promotes social cohesion because it includes migrants with their host communities as well. A second example is from the Philippines. The Philippine Red Cross, also in cooperation with their government, established welfare service desks to provide food and non-food items, psychosocial support, and restoring family link services to migrants who were returning to the Philippines from various places. We regard access to information as an essential basic service, and many national societies respond to the need for accurate, accessible, and timely information in an appropriate format, especially for children and for other groups who are most at risk. The Philippine Red Cross has launched something called the Virtual Volunteer. It's a web-based application that puts vital information directly into the hands of those who most need it. So those are prospective migrants, people who are thinking of migrating, those who are away from home, but also the family members of migrants. They can all access information through their cell phone. And the Virtual Volunteer was updated with the most current information about COVID, including the location of quarantine facilities, government advisories, and contact details of other relevant organizations and agencies who support migrant workers while they're abroad and upon return. The Red Cross Red Crescent movement has compiled an open access online library of COVID-19 risk communication, audio and visual materials. And these cover topics including symptoms and treatment, psychosocial support, rumors and stigma, addressing social stigma, hygiene and the correct usage of masks. And all of these materials are available in a wide variety of different languages, and are easily accessible to anyone who needs them. I can share the link with you all. And the idea is that these resources would, in a way, reduce risks for migrants who might otherwise be hard to reach. So through international cooperation and partnerships, we recognize that it is important to work together. We remind governments that they don't need to act alone towards meeting the objectives of the Global Compact on Migration. It's an opportunity for us as the Red Cross and Red Crescent national societies to engage with our governments on the safety, the dignity and the rights of migrants. And we're using it as an opportunity to showcase and build upon the work that's already underway in other areas, for example, in disaster risk reduction, in social cohesion. But there are areas for improvement. There are also gaps. And this means that the authorities, that the Red Cross, Red Crescent movement and other stakeholders, we must all coordinate our efforts to assess and address the humanitarian needs of migrants in vulnerable situations. But it's also essential that, that national societies, that all humanitarian actors have the necessary space and access to assist all those who are in need. I'll leave it there. Thanks, William. Back to you.
Thanks, Helen. And let me quickly just get back to you and ask you. You've pointed out gaps and challenges at coordination one and the need to work together the other. But what else is not happening for you? Because in many ways, yours is the biggest humanitarian organization. In a time like this, and in the context that we are talking about vulnerabilities, your organization would be the organization that would that should not have a problem in terms of being able to do its work. So if you were to pin down your biggest challenge today, kind of thing, in addressing this issue, like for example in different contexts, let's say in Yemen or in Bangladesh with the Rohingya population, or what is the big challenge you face today?
I'd go back to those last points that I made and say that access is definitely a challenge, and it's particularly difficult in the context of health pandemics, where social distancing measures, physical distancing measures, movement restrictions prohibit the mechanisms that we would otherwise use to reach people, which is to use our network of local volunteers at the village level, at the community level, to reach migrants who themselves often intentionally stay out of reach, or by virtue of the work that they're doing or the locations in which they're living are hard to reach anyway. So one of the biggest challenges, I think, has for many organizations, not just for us, but is actually that access. But on a more kind of formal level, the other barriers that we're seeing are the restrictions on providing essential services to non-citizens, and particularly to irregular migrants as well. And that example I gave from the Maldives just shows how important this closed-door dialogue that we are often able, but not always able, to have with governments about ensuring that humanitarian imperatives, humanitarian principles are upheld, and the importance of that testing and treatment and hopefully soon a vaccine are accessible to all, because as Patrick quoted, we're not all safe until everyone is safe. And so that really does speak to the importance of ensuring that there is not discrimination in the treatment and services that are provided to everybody in a country's territory.
Let me put another pointed question to you then. Do you see a lot more political openness for the work that you all do with migrants, considering that we know that migrants are seen as the other marginalized communities? And do you see that for a humanitarian organization like yours, spread across the world with chapters around the world kind of thing, do you see a lot more political openness, or do you see this window shrinking, or the space shrinking? That is at the political level, at the societal level, at the social level. Do you see, what Sandra was talking about, greater sensitization to your work, and so at the societal level, greater welcoming kind of for your operations? Are these, what I'm saying is, for the kind of work you do, and particularly with migrants, do you see an expansion and an appreciation and openness, or do you see it as a challenge, like so many other NGOs in this field look at, who are involved in rights-based work?
Um, it varies. I mean, from context to context. I'd say, starting off on a positive note, yes, we have seen more political will, and finally the recognition of the importance of the inclusion of non-citizens, of migrants, in COVID response in particular. Thailand is a great example. The Thai Red Cross launched a project at the beginning of the COVID situation here, directly to reach migrant workers, in cooperation, in coordination with those that already had strong networks, because the Thai Red Cross did not, by their own admission. It's not a population with whom they had been targeting their activities up until now. But they brought together key civil society organizations. They are working closely, of course, with the Royal Thai government, and through the network of Red Cross chapters across the country, are able to reach migrant workers with personal protection equipment and with information. We've also seen other national societies taking up activities to reach migrants in their communities as well, that hadn't otherwise. Malaysian Red Crescent is another example. But at the societal level, I think it is also very varied as well. As we all know, there is increasing discrimination, xenophobia, and hate speech around migrants and non-citizens in COVID response as well. So a big challenge and a big part of our work is addressing this social stigma, being sure that the messages that the Red Cross, Red Crescent societies give are the trusted source, that are able to balance some of the other negative narratives that are circulating. So that's a constant challenge and struggle, counterbalancing some of the other negative narratives that are out there, and at the same time maintaining access.
Thanks a lot for that, and that is true. I like that you pointed it out, that the xenophobic kind of language, racist language, the increasing xenophobia that we see today in this time of the COVID as well is a challenge, and it adds to the vulnerabilities. Thank you for that.